The day of the actual procedure begins early, and Mark is picked up from his home at 7:30 a.m. HRBR supplies a discreet and private chauffeur service for any surgical patient that requires it. It's one less thing for them to worry about and ensures that they arrive relaxed and on time. The anticipation of the surgery day can sometimes lower blood sugar levels, so Mark has been encouraged to eat a good breakfast, which will counter this. Once at the clinic, he is shown to a private room, which will be his for the day. To help make him more comfortable, each room has a TV and entertainment system and complimentary Wi-Fi. While he gets settled, the team gathers in the conference room to discuss his case.
Morning everyone. Our patient this morning is Mark Berry, who is a 37-year-old gentleman who was first attending us in September last year.
There will be a team of over 20 people solely dedicated to Mark's procedure, so the lead surgeons present his medical history and go through the plans for the day. They also discuss the number of hair grafts they are likely to transplant throughout the day.
But certainly I'd be disappointed if we don't get 3,500. So the more the merrier.
Good morning, Mark. How are you? I'm Aoife. I'm the nurse looking after you today.
After the meeting, the surgeons and nursing staff chat to Mark about what to expect from the day ahead. He is also asked to sign a consent form and is given his pre-meds.
And you're not on any medication for anything at all. That's good. So I'm going to pop this little ID band on you here.
Mark, Aoife is going to give you some what I call happy tablets. It's a very, very mild form of sedation. It's just to take the edge off the day for you.
Okay.
And it doesn't put you asleep, but a lot of patients have a little snooze. I always say it's a bit like going on a transatlantic flight. A little bit tiring, but relaxing. But at the end of the day, you're going to have substantially more hair on the top of your head.
Thanks, Mel.
All right.
But if you do have a little snooze, all the better.
Okay.
What do you think?
Mark is then brought into the photography room. The team have already done preliminary design work, but it is now that it all comes together to be fine-tuned and agreed. The whole team is involved with this process, and nothing will be decided without Mark's agreement.
Now, Mark, just to give you some idea, if you hold the mirror there, it's not a radical departure from your current appearance. You see, it's really a reinforcing.
Sure.
And when this strong hair from the back gets in there, it'll look totally natural. And then, of course, when the hair grows from here, you'll be able to get a lower fringe, so you'll be able to hide more of the forehead. But you can style it whatever way you want to.
Okay.
Okay.
Brilliant.
What do you think of that now?
Love it.
Mark, I'll just get you to turn and look into that corner for me there. Just chin down slightly, please. And look back around towards me and down towards the floor so I can see the top of your head. Perfect.
Once the design has been agreed, the donor area is prepared. Mark is then taken into the theatre, where the first half of the donor hair will be removed.
So you'll feel a little bit like a bee sting, first couple of stings, and then you won't feel very much at all. And we're going to clean the area first.
How are you doing there, Mark?
Great,
Okay.
really good.
So I prefer patients to put their mind somewhere else rather than focusing on what we're doing.
Sure, okay.
So you've just won the lotto. It's 2 million, and you can plan how to spend it. It'll keep you happy now for at least a half.
Okay, Marius.
Okay, doke.
Thanks so much.
The donor strip is a long, narrow strip taken from the area of permanent hair that's unaffected by the balding process. The procedure requires only a local anaesthetic, so, although slightly sedated, Mark is awake the whole time.
Mark, how are you feeling?
Brilliant, yeah.
Great.
I must admit I had a little bit of a doze.
Good, that's good. It makes it all go faster as well. It all went really well. Very straightforward to take the first part out. So we'll get you through in the next room now, and we'll have you in the opposite position, so
Great.
relaxing backwards.
Yeah, no,
so all good
honestly,
so far. You're not in any discomfort there at all?
honestly, no. Like I think it was just the few initial, kind of,
yeah, the
you know,
pinches.
pinches. But
Yeah.
there afterwards, I was just as comfortable as I would be on my home couch having a snooze.
Steady on, but great.
Yes.
The strip is removed in two halves, one in the morning and one after lunch. This means that the hair grafts are out of the body for the shortest time possible. While Mark is finishing up in theatre, the donor hair is taken into the adjoining lab, where it is first divided into strips, a process known as slivering, and then finally separated into individual grafts ready for transplantation. Each graft may contain between 1 and 4 hairs. A team of highly skilled nurses and technicians will spend the whole day preparing and coordinating the grafts. The high-quality microscopes used for this purpose, uniquely by HRBR, have set an industrial gold standard. Mark is then brought into the planting room, where the actual transplant will take place. A good transplant should be unnoticeable, so there's a special emphasis on the design of the hairline, as it's this area that is most visible. The team begin making the hundreds of miniature incisions that will receive the grafts. All these incisions are made randomly, but in very specific directions, to create a truly natural look. Despite the fact that he's undergoing surgery, he is not in any pain and will be able to kick back and watch a movie or two.
How are you, Mark?
Yeah, really good.
He's really good.
Immediately after lunch, the second strip is
I'm
removed.
just about to take the strip out now.
And once it's done, Mark returns to the planting room for the remainder of the afternoon. Planting is a slow and exacting process for all concerned, requiring a high level of concentration and manual dexterity. And it's this attention to detail that has made HRBR the leading clinic in its field.
Here are your hairs. This is a single follicle.
Okay.
So you can see one little hair sticking out and one little black dot at the end. That's the base of the hair there, the root of it. And all it needs to do is be plonked into a little hole that has potential blood supply that it can then survive on. There's a double, a triple, and a quadruple. 4 hairs. The singles and the twos we will place nearer to the front, which is more visible. It's essentially feathering out of a hairline from kind of dense forelock at the front, and we feather it out.
Amazing.
Yeah.
Okay, Mark, that's it. We're just doing the last final little check there, but all the grafts are in. But basically, you're going to be spraying every 20 minutes this evening. Try and spray through till 7 a.m. Lie down and sleep then for a few hours until maybe 11 or so. And then we'll see you back here tomorrow for a checkup at around 12.
This is going to make a spectacular difference.
Right, well, we will get you to sit forward a little bit there, Mark.
Now, Mark, I'm just going to bring you to the mirror here. So what do you think?
Oh God. I think it's actually amazing. Like to know that there's 3,000 gone in, close to 4,000, is pretty spectacular. And you know, to know that I actually didn't really feel that much pain throughout the whole day.
No.
You know.
Come on, Mark, you didn't feel any pain.
I didn't feel any pain.
But we'll make sure that you've no pain during the evening. We'll give you some painkillers to take.
Appreciate
But
that.
the nursing staff will go through everything with you now.
Okay, great.
Okay.
Thank you.
So,
Thanks, Morris. I really appreciate
you've been
it.
a great patient.
No, thank you.
And
Thank
I'll
you.
be seeing you tomorrow morning for a
Great.
checkup.
It's been a long day, but before Mark leaves, he's given some post-op advice and a take-home kit to assist him in caring for the newly transplanted grafts over the initial few
Okay,
days.
Mark, this is your spray bottle, okay? So this is your best friend for the next 12 hours, okay?
Okay.
So we want you to spray up nice and close, a couple of inches away.
Yeah.
Really blast it. You want to hear that kind of sound coming out of it. Every 20 minutes, spray the whole top of your head and the stitches. Do some spraying with your right hand and do some spraying with your left hand, and that way you won't miss any areas, okay? A bit of alcohol hand gel. Just keep your hands really nice and clean for the first few days when you're spraying, because in case you do touch your hair without thinking about it. So just put it on like hand cream and let it dry. Okay. Any problems with your surgeon's mobile numbers are here, and that's your design, okay? So that's pretty much where they all went and what went where. Okay, so we went all the way back to just this line here, to the very top, right up to the top of the crown. So you got coverage the whole top of your head, basically.
Brilliant.
Yeah,
Fantastic.
super.
Thanks, Ethan. Well, that was the day. Exciting, I suppose. Now it's off home to spray my hair for the next 12 hours, you know. So, yeah, very exciting. Start off a bit apprehensive and a bit nervous, you know, going in. But I must admit, once I met with the guys, met with the team, went in for the operation, must have had a bit of a snooze. And then next thing went in and started getting some of the grafts were put in. But throughout the whole day, it was just it was a really, really comfortable environment. And you know, 3,700 at the end of the day, you know, you can't beat that. So I'm really happy. I'm trying to think of how I'm going to keep myself awake, but I got a few alarm clocks going off around me. Shouldn't be a problem. Brilliant, thanks.
Good luck.